I'm absolutely delighted today to have Danielle Keenan here with us. Danielle is a project manager with Spring Social Prescribing. So Danielle, can you tell us a bit about Spring Social Prescribing and how it has helped to prevent disease and promote health and well-being?
Yeah, sure. So the overall objective and the aim of the project is to create a culture shift from the medical model to the social model of health. So there's increased recognition that the social model of health actually supports and encourages better health outcomes for people and communities. So the project really was set up to build a link between the health service and the community. Typically, GPs and primary care health professionals would make referrals to a social prescriber who is based within a healthy living centre within the community. So we have a team of 34 social prescribers, and they receive referrals and they support people aged 18 and over, and we support people at a tier 1 and a tier 2 level, which is prevention, early intervention, and very much providing low level supports. So really the Spring project is about spending time with people, finding out what matters to them, looking at their holistic, the whole holistic health, and then co-creating a health plan with that person, and guiding them and supporting them to improve their health and their well-being. And then we support them along their path and their journey to improve and maintain their health and well-being.
So you've already touched on a lot of it there, Danielle, on how Spring Social Prescribing works with patients and the communities to kind of better enable them to take control of their own health. What would you say are some of the major outcomes of Spring Social Prescribing to date, and what factors have influenced its success?
Yeah, so I suppose really the Spring project measures outcomes for people, health and social care, government, and communities. So far, our outcomes, we have supported 3,000 people, so just over 3,000 from the project actually started. We do 2 wellbeing assessments, and 85% of the people that have completed their wellbeing assessment have demonstrated improvements, and the average improvement is in health is around 22%. For health and social care, then we have connected with 154 general practices, and the GPs that we are working with are reporting that they are better connected to the community. Their patients are experiencing better health outcomes as a result of their social prescription. So we're measuring improvements alongside health and social care. In terms of communities, then the outcomes for communities, we have an infrastructure and a network of 25 healthy living centres, and as a result of being involved in social prescribing, they are building up new strategic partnerships and links, and they're reporting that they're stronger as a result of being involved in social prescribing. And then in terms of the government, we've developed new partnerships and additional investment from the Department of Agriculture, the Department for Communities, and the NI Housing Executive. They are all now investing in social prescribing, and we are delivering better outcomes, alongside those government departments for people within communities. So that is the outcomes that we are measuring at the moment. And then in terms of our success, I think our model is really the key to our success. The fact that the social prescriber is based within the community is the absolute key to the success of our model. The skills and the expertise of the social prescriber, the relationships that they and partnerships that they have within the community is very helpful in terms of encouraging and supporting people to achieve better outcomes. We have lots of strong, trusted relationships between the community and the statutory sector. So I think really the key is building on relationships, and that really has been so beneficial in improving outcomes for people.
So obviously, your initiative, it's obviously been very, very successful, and I'm just wondering, it seems, embedding a preventive medicine approach like Spring Social Prescribing into health and social care, it's a no-brainer. It seems to make sense. Do you know are there any regional policies or support mechanisms in place to help support initiatives like yours?
Yes, in terms of support mechanisms, there are there's quite a few social prescribing networks. We are very active members in the All Ireland Social Prescribing Network and the newly formed Scottish Network as well. And it's basically a platform where projects and initiatives all come together and they share learning and practice on policy, strategy, evaluation, outcomes and frameworks and so forth. So that is a very strong support mechanism. Just recently in Northern Ireland, the Health and Social Care Board and the Public Health Agency have established a social prescribing regional board. Now it is very much in its early days, but we're hoping that that will be a support mechanism to give strategic direction to social prescribing within Northern Ireland. And then in terms of policies, I think that the new mental health strategy, which is currently under consultation with the Department of Health, that will definitely strengthen our work and support our work over the next few years. And I would say as well that there is very much an urgent need to develop a loneliness strategy within Northern Ireland. I know that it's not quite there at the minute, but it is something that I feel would really shape and support the work that we are doing.
Mm-hmm. So I understand at the minute it's a difficult time for charities and they're under a lot of strain. And I was just wondering, in terms of the barriers and the drivers towards preventive medicine, what would you say at this particular juncture are the particular roadblocks that your charity is facing, and even preventive medicine more generally? And I think you've already touched upon some of the factors that have led to success. What would you say would drive a preventive medicine initiative to successful completion?
I think if we touch on the first part, the barriers, I think it's just a lack of awareness, and I think that there is very much limited investment in terms of preventive interventions and initiatives. So I think that would be the main barriers at the moment. I think the drivers then would be obviously to promote and create more education and awareness. There's lots of people out there that they know they need help, but they don't quite necessarily know where to go. So I think it's about improving health literacy and trying to adopt a population health approach. So I think that would be the drivers and the way forward.
Yeah. Then in terms of looking forward, what would you say are the priority areas for both your own initiative and preventive medicine more generally, both kind of at a national level and then more regionally within Northern Ireland?
I think at a national level, from my perspective, I think that embedding social prescribing into national health improvement policies and strategies, it has to happen really. There is such a strong social movement at the moment, and the UK have included social prescribing in their long-term plan, but I think it needs to go across all nations really. So I think that's something on a national level, and then on a local level, again, I think it comes back to that long-term investment that we need to see more and stronger collaborative working between the community and the statutory sector, and trying to again promote and educate people, and trying to move things forward at a local level.
Mm-hmm. And I think you mentioned earlier that you have 25 hubs, and I think they're across both Northern Ireland and Scotland. And I was just wondering if you foresaw any opportunities to work with other partners across UK and maybe even further afield across Europe.
Yes, we have some partnerships. We're actually involved in a national research project with 4 universities across the UK. We have different partnerships as well outside of our own. So yes, I would absolutely welcome more collaborative working. I think it's all about sharing best practice and trying to move things forward. So I think collaborative working is exactly what we're all about. So I would welcome more opportunities.
Yeah. So Danielle, we're almost at the end of the interview now, and before we finish, I have just one more question for you. And if you can imagine yourself in the enviable position of having an unlimited budget, what would you do with it?
Oh, what a question. So I think definitely employ more social prescribers. We do cover quite a wide range, and we have 34, but we identify there's pockets of needs, throughout other communities. So absolutely employ more social prescribers. Try to get a long-term investment plan for the community as well, meaning that we're delivering more health and well-being programs to encourage people, to improve their health and their well-being. And I think that would be my top two things that I would like to invest in.
So Danielle, I would like to thank you for joining me today. This has been an extremely interesting and insightful chat, and it has been an absolute pleasure talking to you about spring social prescribing.
It's great. Thank you very much.
Thank you.